Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARs is because it can induce lung cancer cell death. The main reason why I tried PPARs liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARs really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA, or Ask Me Anything.
Maybe just the capsule or the powder, just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARs, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Paano po yun nag-start?
Okay. Kasi gito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matangisda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So, sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, Probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Nang lagnat, on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, dati kasi dahil nag-peak yung WBC niya, medyo sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung pagkaisipan na nawala sa wisyo. Dramatically, 1 to 2 days, parang nakita ko siya ng improvement. Doon nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na Same case sa sister ninyo.
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing. Despite medyo may konting kamahalan, but then, kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda. Nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature PPARs. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPAR. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, kinakapa ko siya. Parang nawawa, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
We are live! Healthy day, everyone! My name is Jansen and Mr, a board-certified pharmacist and one of your We are an international distributor of food supplements made from a unique strain of microalgae called PPARs, which has been tried, tested, and certified to support not only general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. Just a quick ask about how SimplyNature PPARs enhances oncological protocols from surgery to radiation, chemotherapy, and even immunotherapy. Moving on tonight, our topic is the role of SimplyNature PPARs in a man. So together, we'll explore different types of tumors and proper treatment, but most importantly, how SimplyNature's PPAR can your health journey. Now, to really understand, need to break down the basics. That's why our topic for tonight is led by two distinguished experts, and it's an honor to present our first esteemed speaker, Dr. Jansen a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. And up next is a seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International. Our PPARs expert from Singapore, you all know him. It's not Sir Shyan.
Good evening, Jen. Good evening to everyone. Today's topic is a bit in terms of PPARs, so more in general, since my expertise in PPARs is in PPARs. So my discussions will always be slightly more skewed and focused on PPARs. However, Dr. Jansen will be joining us at the AMA segment after our brief discussion. So feel free and get ready your thing from today's topic to any Dr. Jansen and myself will be doing our very best to give you answers after our quick discussion today. So I'll hand the time back to Jen, who will then introduce the topic for today.
Yes, thank you, Sir Shan. Conventional treatments such as surgery, chemotherapy, and radiation therapy are, yes, effective for many, but come with limitations. So this is where complementary therapies like SimplyNature PPARs come into the picture, offering additional against tumors. So let's all watch this.
Hi everyone, welcome to another episode of Simply Healed. Today we're going to go into the topic of different types of tumors and the role of SimplyNature PPARs tumors or growths in your body. Over the past few years, I've been presenting to doctors, oncologists, surgical oncologists. I've presented to many integrative doctors who actually deal with other health issues apart from cancer, because when you have a tumor, it could be benign, or it could be something not related to cancer. So today, our topic, I'm going to dive into the different types of cases where you have a growth in your body and then now you're really worried. What should you do?
Lifestyle in the last, 5 years from taking COVID vaccines to new foods, and nowadays our processed food is a whole new level from 20 years ago, and even our natural foods are less healthy than 20 years ago. So many things have changed. So it's very nice. Thank you for sharing your experience with patients, and I think I share that sentiment now. Things that were okay maybe 10 years ago are not so okay right now. So I think Dr. Johnson's advice is really good. So especially if you have a history, cancer history in your family, if you have growths, if the surgery is simple, is straightforward, no complications, maybe you should strongly consider giving yourself peace of mind and just go for it. Yeah.
Up next,
especially benign, right? Because benign,
yes,
if the tumor is benign, you won't have that. Oh, it was malignant, and then you cause the cancer to spread. It's not even cancer in the first place, so there's nothing to spread. So all the more there's really not much downside. And today's surgery is very precision. The incisions are very small. You don't remove much. You only remove what is necessary. So yeah. Jen, sorry.
Okay. The next question is about when it's already malignant. So this is a question of every viewer. Can PPARs replace surgery and chemotherapy?
Why don't I start and then Doc give the
Yeah, yeah,
answer?
yeah.
Okay.
Yes, yes. Go ahead.
Okay, Doc will give you the medical one, and I will give you from a PPARS perspective. My answer is if the surgery is straightforward, if the surgery is how shall we say? If the surgery is simple, straightforward, even I would recommend that you will go for the surgery, right? Because surgery is one of the most direct and effective way to remove or reduce a cancer tumor size because you actually remove the whole cancer tumor completely. If for any reason you want to delay the surgery, number one, check with your onco. If there's sufficient time, ask your uncle what's the timeline, and then give yourself a red line. That means you can try SimplyNature PPAR protocols because it really varies from patient to patient, right? When it comes to natural products, remember, we don't work on the tumor. Our SimplyNature PPAR protocols don't act on the tumor. So any chemotherapy acts on the tumor. That's why the chemotherapy protocol can be confident what it's supposed to do to the tumor because it is acting on the cancer tumor. SimplyNature PPAR protocols actually act on your body's own immune system. Then your body's immune system then does its work. So we can't control exactly what happens to the cancer tumor because we don't act on the cancer tumor. We act on the immune system. Now, chemotherapy is different. So line. That means after you try for a certain amount of time, if it's not giving you the results you want, you go for your chemotherapy. And surgery, our PPAR extracts will reduce the damage, protect you from the chemotherapy, and help you recover in surgery. So actually, the whole process is a win-win. Doc?
Yeah, so I'll give you a straightforward answer. The answer is no. There is nothing, there's no monotherapy for cancer. No one single medication that you can use that would be effective for cancer. Okay? Okay. So it's almost always it's a protocol. So you use different modalities to treat cancer. So the reason this is because cancer has 10 hallmarks. The molecules that the pharma industry developed only targets one of these hallmarks or a few. So you're left with other hallmarks of cancer that makes it grow, that makes it avoid the immune system, that makes it come back, sometimes with a vengeance. So cancer is, there's no one single therapy that can treat cancer yet.
Totally
There is one such procedure that might, I'm not sure yet, but because it's new, it's still in clinical studies, but it exists already. This is the mRNA vaccine for cancer. So this is personalized treatment. So this I believe I have mentioned this years ago in our webinars, in that the mRNA vaccine for cancer is personalized. So they get a receptor or a protein that is unique in that tumor, then they develop a vaccine against that protein. So when you get vaccinated with that, your immune system will now be able to detect the tumor cells as foreign. So it will eat the tumor. Yeah, so this is one singular treatment wherein when we give it, then the patient can go into remission. Yeah, so this is a possibility. However, the staging. So right now, what we have, the article that I read a week ago, is saying that mRNA vaccine for cancer is only used after the chemo, after radiation, after surgery, or if the chemo or the radiation or whatever conventional cancer treatment did not work. That's what they're saying. So I'll be honest, I still don't know why they are saying such. yeah, probably there must be nuances around it, no? But
Yeah.
in theory, this is one very promising treatment for cancer that is being developed right now. So the future is very, very hopeful, especially the next 5 years to 10 years, especially with AI. This will be accelerated, definitely.
Ah,
Yeah. Mhm.
but no, you know so it's very interesting. Today we say that there's no one shot, no one thing that will cure cancer. So our approach to cancer is always multidisciplinary. So
Yes.
we also share with many of our clients about PPARs. It's so fantastic. Uh, we prefer to let our patients know that PPARs is a good foundational, how shall we say, support for cancer care and natural aspect of the existing ones first, and it's the last resort. So to me, to all our viewers, my view on it just means that the existing procedures are so well understood, right? That they are the reliable approach. And with the mRNA, Doc, this is my speculation, is that like when they say COVID vaccine, the mRNA was totally safe. Today, now 4 years after the first vaccines were introduced, there is one thing they did realize. There is a huge spike in cardio issues after those who have been vaccinated with the vaccine. It's not a direct immediate causal. It could be a cofactor, or just like when we say these are factors in developing cancer. It doesn't cause cancer, but it's a factor. Maybe the vaccines are like that. So that's why perhaps there still needs to be fine-tuning, but it's very hopeful, as Dr. Jansen says, with AI, we can speed up the, how shall we say, the monitoring and managing the variables, because AI can go through lots and thousands and millions of scenarios very quickly. So that's something to look forward to. Okay, but everybody, there we go.
Okay, before we move on to the next question, let me just greet one of our avid viewers, Miss Helen Kamunayan from Baguio. Good evening po. Okay, next question is from Ma'am Christina. She says, good day po. Taking PPARs Plus when taking, namely tenofovir, disoproxil, I'm also a breast cancer patient. Thank you. PPARs.
They're safe, no? It won't have any negative. But if I were you, I would space them out, no, just to avoid stomach upset, no, any possible stomach upset. So, or the one medication affecting the absorption of the other. So just space them out. But there are no evidences in the medical literature that we have that they affect each other negatively or synergistically, for that matter.
Yep. So, to support Dr. Johnson, even at Simply Nature, we know there's no contraindication with many drugs. In fact, however, as Dr. Johnson said, there is one consideration why we want to space out the intake, which is how the thing is being absorbed. We just don't want to mix the absorption. And that's it. Yeah, that's the key consideration. Jhen, I saw a question which I would like to answer. It's from Miss Susan Salute. She says she just bought Simply Nature PPARs extract powder in jar form from Shopee. Singapore expiration is 2026, but the color of the powder is brown and it's not dark green. Okay, this is a very good question. And this is a question that comes up quite often. Number one, I'll go straight to give you the answer. Yes, it is still the same in effect. But then you ask me, but the color is different, okay? Yes, the color is different, but the reason for color differences is because our product is really 100% natural, and we really try to reduce. So that means we don't add any chemicals to maintain standard color. We don't do stabilizers or anything. So really, the color actually changes from batch because of the season in which the microalgae was harvested. All right. You will notice that if I'm not wrong, in winter seasons, the color is I get confused. The difference is basically from brown to dark green. Okay, so that's the range of colors. It's got to do with the amount of sunlight that the algae experiences, the intensity of the sunlight that the algae experiences. So in winter, you experience less intense sunlight and for a shorter amount of time, right? So, but this does not affect the PPAR agonist, all right? It does not affect the PPAR agonist. It does probably, the color change is probably about chlorophyll activity, you know, based on how much sunlight it was exposed to. So, and algae will react to amount of radiation or the sunlight that they are exposed to, and that will change their pigmentation. So, for example, there is a product called Xanthan. It's actually red in color. That's because they bombard the algae with so much artificial radiation that the algae reacts in extreme response to the high level of radiation. So this is first created in Israel, and they put it out in the desert sun. All right, so that one is very high in antioxidants. Okay, that one, it creates a lot of antioxidants. That's because the algae reacts. However, that's very different from how PPARs works. PPAR works by activating PPAR pathways. So it's not about antioxidant level, okay? It's about activating PPAR pathways, and that's independent of how much sunlight the algae gets, okay? So to answer your question, yes, it is stain benefits, all right? It just proves to you that your PPAR powder is actually a natural product and not something with added coloring so that every batch is the same color, yeah. Wait, I think this is important for all the viewers, all right? Jhen?
Yeah, that's the answer for all seasons. Okay, next question from Mom Deborah. My grandma had breast cancer. My aunt also had breast cancer. Is having a breast cancer also high for me and my kids? And if yes, how can I prevent it?
Okay. I would probably gauge it as moderate, no? It's not really that high. But what I would consider as very high risk would be the immediate family. So if your mom has history of cancer, or if your sister has cancer, then that would be very, very high risk. Okay, but for your grandmother, yes, the risk is elevated, but it won't be as high as if you have an immediate family member that has cancer. So.
Doc, you mentioned before, right? Because we talked about the science of epigenetics. It's about switching on and off genes. So one good news is that for this particular viewer, the grandma has cancer, the mom does not. So there's a possibility that due to the mother, this viewer's children might have their cancer genes switched off, right? If they
That's a
successfully.
possibility. Yes,
Yeah,
that's a possibility.
Yeah, so
Yeah.
if you keep yourself a healthy lifestyle and you don't develop cancer, that it will break this chain of cancer happening in your family. But if you have cancer in this family and you don't take care of your health, you allow the cancer to develop again, you sort of reinforce that your children and your grandchildren will actually develop cancer.
Yeah.
So yeah, it's not written in stone. You can actually switch it on and off. So that's the good news,
Yes.
right?
This is something generational, okay, especially for ladies, no? Because when a woman gets pregnant, say the baby is a female. So during the development of the female fetus's ovaries are also developing at the same time, and the quality of the ovaries, the egg cells inside, no, while the fetus is still inside the mom's womb, that the development the epigenetics can affect the quality of the egg cells already. So this is generational. So for women who are pregnant, if the environment in which you are living and your lifestyle is quite unhealthy and the environment is quite toxic, then that would definitely affect your granddaughter or your grandchildren. Okay, so very important. Very important. This is actually very, very important, especially nowadays, because our environment has a lot of toxins already.
Yeah, so Doc, one crazy as in very surprising result was that they found that mothers who were experiencing the 911, event, the terrorist attack, who were pregnant at that time, their kids actually, after they were born, had higher incidence of brain disorders, like depression and things like that. So it really means that, for all pregnant ladies, what you do when you're pregnant does have an impact on your children and after they are born. So do take care of yourself when you're pregnant. And so this is to all the husbands. Make your wife happy when they are pregnant. Don't go and stress them when they're pregnant, all right? Yeah.
Okay, next question.
Jhen, I saw one that's very interesting.
Okay,
It's Miss Jhen Chan Ang.
yeah, I was about to read that now.
Yeah, she said, can PPARs have positive effect on seizure and epilepsy? So I actually took the chance to review the literature because I saw this question early, right? Number one, Ms. Jhen, as a company, I cannot deliberately use PPARs for seizures or epilepsy, okay? We have deliberately prescribed and encouraged the use of PPARs for stroke patients because it does have a neuroprotective and helps the brain recover. So it has been proven to be effective in helping, for example, stroke patients regain their mobility together with, for example, physiotherapy treatments and together with like liquid extract, okay? But I took a look at the mechanisms of action and I'm surprised. So I really thank you for this question because your question prompted me to take a look at whether our PPAR agonists may help with seizures and epilepsy. So in theory, so from a looking at mechanism of action, number one, inflammatory or modulation of inflammatory. So they actually listed like pioglitazones, like PPAR gammas. So these are drugs, PPAR drugs, okay, suppresses pro-inflammatory cytokines. So all these actually contribute or are part of seizures and epilepsy. So it's like positive mechanisms of action to be able to help or help seizures and epilepsy, not actually treat, right? Okay, these are like factors that will contribute or affect a patient who suffers from seizures and epilepsy. Next is the reduction of oxidative stress. So PPAR alpha and gamma, which is what our SimplyNature PPARs is actually rich in, alpha and gamma. Okay, because there are three forms of PPAR. Alpha, gamma, rich in alpha and gamma, and gamma more than alpha. Okay, but we are rich in both. Okay, so regulation of neuronal excitability, PPAR alpha, such as phenofibrates, all these actually show it is helpful. It shouldn't be your primary treatment, but I guess if you have treatment for seizures and epilepsy, then I think PPAR extracts might be ideal supplementation, right? Because there are mechanisms of action that should help. One is neuroprotective properties. So this one is PPAR gamma. Promote survival of neurons by reducing cell death or apoptosis in the brain. That's very interesting, right? Yeah, there's actually a whole list. So I just want to touch on this to say that no, we do not as a company, nor do we specifically seek out patients with seizures and epilepsy protocols with, but looking at the literature and mechanisms of action, it seems promising. So if you are looking for a supplement for epilepsy, then I would say really try PPARs because from the mechanisms of action, it's promising, but don't use it as a primary treatment or primary modality. Doc, do you have anything to add? Yeah.
I have basically the same answer. PPARs, well, the problem with seizures and epilepsy, is the unregulated firing of nerve signals or brain signals. So this is usually as a result of inflammation, and with seizure, it will also cause inflammation in the brain. So PPARs can definitely have some protective effect or some benefit, in this regard, because PPARs have very good anti-inflammatory properties and antioxidants, no? And with this, and algaes are very rich in omega-3s as well, which would help brain function as well. Okay, so if you are someone who has a seizure disorder or probably a stroke patient, it it would definitely microalgae supplements, no? Like SimplyNature PPARs. But the main factor is the dosing. So the main factor is the dosing. So you have to see a healthcare practitioner to know the dosing for this.
Yeah. Doc, on a related one, someone asked, can PPARs help me with brain tumor? I will have my radiation therapy next week. My immediate response is, oh, most definitely, because radiation therapy, so what you want to do is actually just, as Dr. Jansen mentioned for seizure and epilepsy, manage the inflammation that comes from the treatment itself. You won't, for radiation therapy, you won't have to worry about contraindications because radiation therapy is very targeted, right? It's like literally shooting a bullet. So there's no contraindication left to do when it comes to radiation therapy. But Doc, maybe you can share from your perspective.
Yeah, definitely you can take PPARs, no, if you are undergoing radiation therapy. One very common side effect of radiation therapy is fatigue. This is as a result of inflammation, the free radicals that the radiation therapy generates, no. And since PPARs is a good antioxidant, it can help scavenge the free radicals that are T-generated. So what I would advise is for you to take PPARs after the radiation therapy, okay? Because RT is an oxidative therapy. PPARs is antioxidant. So it would be better if you take the PPARs after the radiation therapy. So this is every single day, okay? Every single day. Because RT is Monday to Friday.
No, I just wanted to catch something that you shared. So one of the main because we are talking about cancer, right? So cancer patients are often fatigued. So fatigue, as what you mentioned just now, is largely one of the main factors of fatigue is inflammation. So if you have chronic inflammation, you'll be easily understanding.
Correct. Yes.
All right.
Correct.
So everybody, that's something we learned today, right? Okay. If you are tired, so does this mean also for like non-cancer patients, right? Okay, you are easily fatigued. So it is a good, strong possibility that you are suffering.
Yes. Actually, almost always, no. We integrative medicine practitioners, that's always something that we look at of my issues, why I'm chronically fatigued. So just okay, we know that already. So can I take PPARs? Can I just take any supplements, no, like SimplyNature PPARs for my fatigue? Answer is yes.
Yeah.
Yeah,
And then
answer is yes. Definitely.
Yeah, and if it doesn't work, you explore other opportunities. But this is the first one where it's very obvious and easy approach.
Yeah,
Thank you,
so
Doc.
you can just try.
Yeah, we learned something clear. We are very clear about something today. Inflammation is your primary or one of the main reasons why you're fatigued. So if you are feeling fatigued, you are probably inflamed, and inflammation can be caused by stress. That's really wonderful.
Okay, speaking of brain tumor and radiation therapy, shout out to one of our avid viewers, Miss Naomi. Okay, and next question is from YouTube. Good day, Doc. I just want, my stomach is full. It feels like there's a sting. What could this be?
I also wonder what it is. I have to know, but the first diagnosis that comes to mind is ulcer, stomach ulcer. Yeah. There's another one, gallstones.
Oh.
So we have to investigate. No, we have to investigate this further. So you can schedule a consult. I'll be here waiting for you. Just message, and one of the healthcare specialists will uh, connect with you.
Yes. For those of you who wish to...
I just want to take the opportunity, right? It's a question like this, it's a concern like this that I think it's so wonderful to have teleconsult now, because we live in Metro Manila, just to go anywhere, it could be number one, you have to take you have to file for leave absence from your work, and then you have to spend like 4 hours, minimum 4 hours, traveling to the clinic and then queuing up at the clinic. It's like a whole, and then sometimes we put aside these small pains because we don't think if it doesn't kill me, okay, it's not so important. I don't have I think so. I just want to encourage everybody. I think the wonderful thing about teleconsult is you can actually schedule a time to take a work break, and during that time because a teleconsult is actually usually very on time, right? If you miss, someone else will use your slot. So it's very on time. You can actually manage when you're going to talk to your doctor. So I would just it's perfect for a concern like this. You don't have to take leave from work. You don't have to brave traffic for 4 hours. You don't have to queue up any clinic. Just set a teleconsult appointment, and you can ask Dr. Jansen. And if it's out something that is really, Dr. Jansen say, you know what, I really need to palpate. I really need to see more. And why not when you come down, right? We do some diagnosis. Yeah, so I think it's really wonderful. So to everyone, make use of this opportunity. And I just want to quickly say, Dr. Jansen's schedule fills up very quickly. So we are in the first 2 weeks of January. So if you have any of these small ailments and you want to quickly consult him, please go and book his time right now. Because once the rest of the month starts, his schedule is very hard. It's always very packed. All right. And then
I'll just let you know a glimpse of my schedule tomorrow. I won't be able to have lunch tomorrow.
Oh, wow.
So this is a glimpse. Next week, I still have vacant slots. No? So yeah, this is what Sir Shyan is saying.
All right. So please take the opportunity. All right.
Yes. For those of you who wish to have a consult with Doc Jansen Calalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Miss Beth and Miss Irish, will reach out to you. Question thrown to us privately: mammogram be performed or tested for a woman with breast cancer history?
If you have breast cancer diagnosis already, mammogram would not be done anymore. Yeah, mammogram is used for screening only. Screening only. But if you already have a diagnosis, we don't do mammograms anymore. Other imaging modalities would have to be used. Ultrasound would make sense, but more often than not, we use CT scans to check on the size. Yeah, PET CT scans as well to check metastatic status. So mammograms, we don't request for that already once the diagnosis of breast cancer has been established.
All right. So if you've been told that you have breast cancer, you shouldn't be doing mammograms anymore. After that, it will be PET scans and CT scans.
Yes, correct. That's it.
Okay, thank you for the clarification, Doc. Next question. For ongoing tuberculosis medication, which PPARs would be perfect for me?
Infections, so tablets, soft gels.
Yeah,
that's what I would advise.
Yeah, all right.
Okay.
So if you have tuberculosis, you would I would suggest like 1 blister of soft gel, because if you are having tuberculosis, it's not something that you ignore. It's something that you want to treat. So you are probably on antibiotics. So I would suggest both soft gels and tablets, because it's gonna just help you beef up your immune system as strong as possible within the shortest time as possible, but yet not go into the expensive level of the extracts, because it's not cancer or anything life-threatening immediately. But again, it's not a cough, okay? It's actually tuberculosis. So you should, if you can, I would really suggest taking 1 soft gel capsule a day plus 10 micro tablets twice a day, right? So that's like, yeah. stronger than just tablets, at least for 10 days, so that you doing your best to beef yourself up. You do want to combat that tuberculosis aggressively. Yeah.
I can say tonight is really ask me anything because the
It's everywhere.
constraints are everywhere. Yeah. Our next question now.
Tonight's questions are interesting, and we are getting. I learned something from Doc Jansen tonight, so I'm happy already because I learned something from Doc Jansen tonight.
Everything.
Yeah.
Okay, moving on to the next question. How to differentiate heartburn and heart attack?
Very, very different, no? What's the difference between heartburn and heart attack? Okay, heartburn is very simple. You have a bitter taste on your tongue or on your throat. You can literally feel the acid going up your chest. That can produce some burning sensation on this part in the middle of your chest, no? Yeah, heartburn can also, or acid reflux, no, can also result to hoarseness of voice. Yeah, because your larynx, your voice box gets irritated by the stomach acid. Okay. So this is heartburn or acid reflux. Heart attack is very, very different. Okay, so heart attack is chest heaviness. Sometimes the chest heaviness can be on the epigastric region. So it's very different from heartburn, where in heartburn, you can literally feel your stomach contents going up. So it's a warm sensation. It's not heaviness. Okay? The epigastric pain. Epigastric. So epigastric is the part of your abdomen just above the navel. Okay? So that's the epigastric region. So if you are someone who's developing heart attack, you can actually feel discomfort over there. The main description is heaviness. It feels like there is a hollow block sitting on top of your abdomen. Okay. This is the more important characteristic or sign that you have to look out for. Okay. This also goes to you viewers who are healthcare practitioners, especially nurses, who are in the I've had my this is a story when I was still a student. Okay. We had a patient come in. Patient is complaining of stomach pain. So when the patient came in, so we interviewed the patient. Okay, this is the history. This is what happened. This is what the patient feels. We gave him antacids, sent him home. Patient came back complaining of chest pain. We did an ECG. Lo and behold, it's a heart attack. It's heart attack. So we missed it. Okay, we missed it. So you have to be careful. Patient comes in complaining of epigastric pain. In the ER, you always request for an ECG. Okay, always request for an ECG. Okay, but this is for the healthcare practitioners side already. I mean, ECG is cheap. You just request for it. Anyway, the patient is already there. Rule out. You have to rule out heart attack. Okay. So, in the point of view of a patient, okay, this is where it becomes more nuanced, okay? Because you won't know, no? Is my stomach pain a heart attack already? I don't know what's the difference, okay? So again, no, heart attack that manifests as stomach pain it's heaviness. Okay, it's not piercing. The pain is not piercing. The pain is not burning. The pain is not it's different from something that something is twisting your insides. It's not like that. It's heaviness. No, so imagine a very heavy object that is placed on top of your stomach. That's how it feels. Same thing on the chest. Okay, it's
So
hollow block.
it's hard to breathe.
Yes, it's hard to breathe. It's hard to
Yeah,
breathe.
I remember my mom having a heart attack, a mild heart attack. When I was in Singapore, it was the middle of the night, and she would hold her chest, and she's like, "Asked her, is it sharp pain or what?" And she said it's painful, but I could tell it's like there was a heavy object on her chest like that. She would grab her chest and like it's heavy, as what Dr. Jansen said, right? So it's not a burning sensation. But yeah, that and I could see my mom, the way her facial expression, I just can tell, like what Dr. Jansen is saying now makes sense to me. You can tell the difference between like burning sensation and heaviness. So my mom looked like it was heaviness, and yeah, Doc, she had a heart attack. The other time she was complaining about pain and she was like beating her chest, like oh pain. It turned out she had it was heartburn. So yeah, just wanted to share that. Thank you, Doc.
Okay. Now going back to breast cancer. What
Okay.
PPARs is recommended for breast cancer with metastasis on bones, lungs, and brain?
I know what Doc would say, and I will
Wait. Can you repeat the question again?
breast
Sorry.
cancer
What?
metastasized to
Okay.
bones, lungs, and brain.
Yes.
Does breast cancer metastasize to bone, lungs, and brain?
What is the PPARs recommended for
The
breast cancer?
recommendation.
Yes.
Yeah.
Okay, so this is stage 4 cancer. It's liquid.
Yeah, that's
Liquid.
right. The best.
I have to be honest no with this. Before, when I was still starting with my practice, no, earlier, a few years back, I delineating stage 1, stage 2, stage 3, stage 4. Then I recommend specific PPARS protocol. I changed my protocol already. So regardless of stage, may it be 1 or 4, it's always liquid. That's what what I'm doing already now. So for my patients who are with me already for a very long period of time, you will notice this change, no? The only time that I advise another protocol aside from the liquid is number 1 is of course financial constraints, not swallow anymore. Then I will change to powder. I'll just match or approximate the dose equivalent of the powder, the number of scoops to the 1 vial of liquid. So that's what I do now.
I want to support Doc Jansen and share with him also. Doc, same for me. You know, in the beginning, because in Philippines we meet many patients who have financial difficulties. Sometimes we think too much or we care too much. we worry for the financial strain. For the patient to manage their financial stress. Right? Like Doc Jansen, over the years, I realized something, you know, cancer is something that can be very unpredictable. A person can suddenly move from stage 2 to stage 3 to stage 4. And sometimes it can be very, very rapid. And to not let the patient know what is the best. I now realize, like Dr. Jansen, I've changed. I now think it's a disservice to the patient, right? So this is something that I feel because cancer can cause a death, right? So if I didn't tell you the best, and then you will say, you know what? Gladly sold the house, you know, to let mom try. Even if it didn't work, we would have at least been able to try, you know. So those scenarios have made me, you know, change my stance. I'll tell you the very best, right? And then if it's financially challenging, then we come out with a best fit for your finances. And most of the time, we will still start with the liquid, but we will quickly shift down to the powder. So we will still want to start with the best and then be able to shift down to something more affordable. So to all cancer patients, you know, sometimes we do recommend like powder. Doc Jansen is not the only one. We have other doctors. I remember one, Dr. Maribel. I'm not sure if you've met Dr. Maribel. She's a very senior.
Yeah, I have.
You know what she said? She said, I will not prejudge my patient's ability to afford anything. So she said, I will always just tell them the best. And then after that, if it's difficult, then we work out what they can afford. But she will always tell them the best. Yeah. So yeah, I just wanted to thank you, Doc, for that very personal sharing. And I think this is really wonderful because sometimes patients think that the doctor is trying to make money off them and recommend the like most expensive treatment. So I just want to share, as you can tell from Doc Johnson's the way he shared just now and what I'm sharing, we also experience on the other side that we didn't give the patient's family a choice. We decided for them, you can't afford or it'll be too expensive for you. I think that is even more painful when we realize the family would have wanted to try anything because they love the family member a lot. So I hope this is something that will help all our viewers better understand at least where me and Dr. Johnson are coming from. Okay, yeah.
Okay. We're almost at the end of the webinar. This will be our last 3 questions for tonight. Okay, the first question, which PPARs would be perfect for a lady who is planning to conceive but has a PCOS?
Oh,
Blitz and soft gin.
Yeah.
Blitz and soft
Yeah.
gin.
Just soft gel. Yeah. Okay. Wait. She's already going to conceive or
Planning to conceive.
planning to conceive? Yeah. Yeah. Soft gel is great.
Very straight
Yeah,
answer. Okay, next
Very straight
question. Is not obese or not on the heavy side, is it still possible for her to still have PCOS?
Yes. Yes. Yeah. I have seen. I know some people. Very slim. Actually, this. Yeah. Actually, this patient. No. Not a patient. No. Someone I knew before. You wouldn't think of this lady to have because she is really slim. Her figure is really good. Okay, but she has PCOS. So having PCOS is not entirely dependent whether you are obese or not, because having PCOS can lead to obesity. Okay. So PCOS, the causes of PCOS can be hormone. PCOS can also lead to hormonal imbalance. Okay. Now, in the articles that I have read, the root cause of PCOS, no, especially in the environment, are food that we eat, especially if you are eating too much processed foods, especially early on in your life when you're okay? So mothers who are feeding their children of hot dogs, sausages, these food, be careful, making them healthier or taking care of them. Um, Now, yeah. So this is one important dietary factor. Another important environmental factor is cosmetics, personal care products. But
Wow.
this is more of a more chronic exposure, especially for ladies wherein you are working in an industry that is wherein these products are heavily used. Okay? I mean, you won't actually have a choice because it's what is needed to be used. Okay? Especially in show business, for example, in theater. If you are someone who, if you're an actor, no, you makeup artist, these industries, or if you're in a manufacturing plant that makes these products. So you would be affected definitely. So this is for ladies, no? So yeah, this can also be a source of a reason why you can develop PCOS later on or any other disease later.
I'm curious, Doc, what's the equivalent of PCOS to men?
Yeah. Do men
We
have
don't
something?
have ovaries, so we don't
Yeah,
have.
so
Yeah. So we don't. But for men, the manifestation can be obesity. Can be obesity. Sometimes the obesity becomes so bad it disrupts our testosterone. So yeah, it disrupts our testosterone. So can be that way.
Okay.
Wow, Jen, our viewership today is very steady and it's the highest for this year so far. Strong start. Yeah.
Maybe because they miss me, sir.
Yeah.
Okay, let's go down to the
Good
last
one.
question. Have you had any case of benign tumor that was removed just with PPARs?
Yes, I have had my fair share of patients. Thyroid, there's one thyroid, there's one myoma, but the myoma is really very, very small. So
Yeah.
it was less than a centimeter, disappeared. For the thyroid problem, it was also quite small. The thyroid cyst or the lesion in the thyroid was supposed to be for biopsy, but when the patient went for the biopsy, went for the schedule, the doctor was not able to perform the biopsy because the one that he will biopsy disappeared. So yeah, okay, the doctor sent to the patient home.
So
So that's yeah.
So the answer is yes, right? And just right from the beginning, in my discussion, was talking about benign nodules for the worship leader, right, in her throat. 5, if I'm not wrong. Yeah. So yes, the answer is yes. The answer is yes. Yeah. Go ahead and try. No harm. And even in the worst case scenario, your other health will improve. Your metabolic syndromes, all these will be improved. Okay. Yeah.
All right. It looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Doc.
Yeah, this year is very promising, especially with the advent of. Actually, we are already not in the advent of AI. We're already
Yeah.
at the rise of AI. Okay,